Hey everybody, Dr. Rob Silverman here. I have Nicole Visnic, and I have to tell you, she has got one of the most impressive bios imaginable. So I'm going to parse through it as we go, but the bottom line is I really want to thank everybody for taking some time to come today. We are going to talk about something that is of great interest. It's called SIBO, small intestinal bacterial overgrowth. We're going to talk about functional gastrointestinal disorders, this being the big one. But first, how you doing today?
I'm great. So glad to be here.
I'm so glad I could get you. I know you're really busy. I had met and spoken with your husband. He was a podcast guest. He did a great job. And he said, you know what? If you think that we were in simpatico, wait till you and your wife get to talking. And then I found out all that you do. Why don't you tell us a little bit about what you do every day and how you help people from the inside out?
Yeah. So early in my career as a clinical nutritionist, I started working for an integrative medical clinic. And in this clinic, I was very fortunate early on to be able to see complex cases. I mean, right out of the gate. And I learned a lot of things early on, which, based on my education, getting a master's degree in clinical nutrition, some things just weren't lining up. So for instance, when I'd see some of these complicated cases and I'd applied what I knew using a lot of condition-based protocols, I'd see that they actually didn't work the way that they were supposed to. So for instance, I could have two people that have SIBO and let's say it's the same kind of SIBO. They both have methane predominant SIBO, give them the same protocol, but they would respond differently. Some would get better, some wouldn't. And right away, this interested me. I was confused and also intrigued as to the notion that there were these inter-individual differences that would determine whether or not somebody would respond to the same type of protocol. And so I wanted to understand, how do I get, into the nuances that make people different, and how do I get them good results and get them results more quickly? And so another part of my experience early on was having a high volume of clients. So being able to see a lot of different people with the same types of issues helped me to start to kind of detect patterns. And that pattern detection over time was what allowed me to really be able to think about people in the way that they truly are, which is biopsychosocial creatures. And that there's a lot more to the story sometimes than even their clinical picture. And so every single day I'm seeing clients who have been dealing with chronic conditions for years, and if not decades, and they're suffering. There's a psychological toll. There's obviously a physical toll. And it broke my heart to work with individuals who are just struggling and feeling hopeless and broken, and as though they're destined for a life of suffering. And so I became intensely interested in helping these people and guiding them throughout their journey to get better.
It's a great journey. And we all know that the gut is the epicenter of our health. 80% of our immune cells are in our gut. So we use the word SIBO, or the acronym SIBO, kind of like we understand what's going on, and we assume everybody outside understands what SIBO is. Can we get a brief definition in your words? What is SIBO?
SIBO, yes. So this is a condition in which the bacteria in the small intestine has overgrown. So normally we have somewhere between 10 to the third population of bacteria in the small intestine. But when that exceeds that and we get to 10 to the sixth or 10 to the seventh, that's way too much bacteria, and it's in the wrong place. And a lot of times this bacteria is also dysbiotic, meaning there's an improper balance of these different strains of bacteria. And what happens when there's too much bacteria is that when an individual eats carbohydrates, those bacteria use the carbohydrates to produce gases like hydrogen, methane, hydrogen sulfide, and that causes symptoms, being gas, bloating, and bowel changes, either constipation, diarrhea, or a combination of the two. And so we have the symptoms that are associated, but then there's also consequences to producing these gases. There's a lot of inflammation that occurs, and that inflammation unfortunately damages the gut lining and makes it highly permeable. And now we start to get partially digested proteins that are sneaking into the bloodstream, causing big immune reactions. We get endotoxins that are released from bacteria getting into the bloodstream. And also the enzymes that live in the brush border begin to be destroyed. So now we don't even have the enzymes that are necessary to break down carbohydrates in the first place. And so this leads to a lot of symptoms that are even outside of the GI tract. So for instance, there's many conditions that are associated like rosacea, rheumatoid arthritis, restless leg syndrome. There's just many other basically symptoms that are not GI that begin to develop.
A great overview. So let's drill down on a couple of things. You made a good point. We're really not supposed to have a lot or bacteria in the small intestine. Bacteria should be in the large intestine, whereas it shouldn't be in the small intestine. So we know that there are some mechanical issues between the small and large intestine, which I'm sure, you'll expand upon a little: migrating motor complex, the ileocecal valve, things of that nature. So the small intestine is where we're supposed to pass all these small digestive food particles, vitamins, nutrients, water, and maybe some bacteria, viruses, and pathogens. So people don't realize we're not supposed to grow it there. Use the word dysbiotic, dysbiosis, and unleveling of good and bad bacteria. You made a great point about carbohydrates. They ferment with the bacteria, and that causes gas. So essentially, people who have gas really are having gas from bad bacteria digestion. So that's what a lot of my patients say. So that's great. And, you talked about the enzymes in the brush border. This damage doesn't allow us to have enzymatic reactions. Now, you brought up the word gas. So I'm going to go right in there. What gases are you talking about? And what with those gases, how do you test for this thing? I mean, this is early in the conversation, but let's get it right out there, and then I'll unpack it back a little bit.
Sure. So when we are trying to determine whether or not the symptoms are SIBO, because those symptoms can be other conditions, that could be SIFO, it could be, post-infectious IBS. There's many other conditions that are associated with those. So we want to figure out, is this actually SIBO? So we would use a breath test in which the client will either be taking glucose or lactulose and capturing their breath every 15 to 20 minutes. And if we see a certain rise in these gases, and of course there's criteria for this, we know that SIBO is present. So there's 3 potential gases. Someone could have hydrogen predominant SIBO, methane predominant SIBO, or hydrogen sulfide predominant SIBO. And depending on the type of gas is usually going to determine what types of symptoms. So usually if someone has methane predominant SIBO, they're going to be prone to constipation. If they have hydrogen, they're going to be prone to diarrhea. So we're going to use that test to, number 1, determine which gas they're producing the most of, but then number 2, to guide the treatments, because the treatments are different depending on the type of gas that's present.
Now, interesting with SIBO, one of the things that people ask is, how is SIBO different than leaky gut?
So they are different, because you could have leaky gut and not have SIBO. So that is completely possible. And it's easy to happen. The intestinal tract, it has only one cell of thickness that really protects it, and it can be damaged by a number of substances, ranging from non-steroidal anti-inflammatories to alcohol to even consuming certain types of foods that may not be compatible for the individual. And so that can happen independent of SIBO. But if someone has SIBO, it's very, very likely that they are going to also have leaky gut because of the sheer amount of inflammation that's caused from having this overgrowth of bacteria.
So if you have SIBO, you may also have leaky gut. If you have leaky gut, you may not necessarily have SIBO.
Correct.
So that's a big takeaway for everybody listening. So if I get diagnosed with SIBO, I'm probably checking all the boxes. So now not only do I have an overgrowth of bacteria in my gut, I've got increased intestinal permeability. Things are passing. It's really bad. Now, it's interesting. I had a couple of GI docs that have recently come in for chiropractic treatment. And unfortunately, I'm going to put this politically correct. They didn't buy the increased intestinal permeability, and they weren't addressing SIBO. So how do you express to all those people who think that they have SIBO, who have gas, who are having a food baby? That's a great example of SIBO. What do you tell them to look for? What symptoms are they really going to have so they know that they need to get a SIBO test or find a practitioner like yourself?
I actually think it's relatively easy to get a client's buy-in on leaky gut, because normally someone who has SIBO is also experiencing neuroinflammation, and there's symptoms of that. It could be fatigue, brain fog, feeling more anxious, being more prone to depression. So there are changes that are also happening within the brain that they're experiencing. And that is one way, I think, of explaining this connection between having a leaky gut and experiencing other types of symptoms, particularly imbalances with their neurochemistry.
Interesting. So with the SIBO, you've talked about the tests. What protocols would you recommend? So if I come in to see you and you diagnose me with SIBO and you diff-die me with leaky gut, let's assume I just have SIBO in this one instance. What would be some of the suggestions, both supplemental and lifestyle?
Sure. So you have three different ways of going about addressing this, getting to the root cause and eradicating that overgrowth. So you can use antibiotics. And because I do work in an integrative clinical setting, I have physicians who can order those antibiotics. You can use herbal antibiotics or an elemental diet. In large part, I will get a really good sense of how willing is the client to make changes. Because if someone is feeling very depleted, overwhelmed, and they're not going to be able to handle a protocol that's very robust, we may do something that's much more simple, albeit a little more aggressive, like an elemental diet. And this elemental diet has the ability, number one, to reduce symptoms right away, and number two, to completely eradicate the SIBO in the first place. So if somebody, and I have a lot of these clients who don't like to cook, they're unfamiliar with just being in the kitchen at all. And so having to follow a dietary plan that requires a very specific way of eating or taking a lot of supplements, it may not work for them. And so that's where I really start to think about, what are the beliefs that this person has about their ability to follow a plan? What are their actual skills in terms of cooking, shopping, preparing, prepping? What other kind of outside influences may inhibit them from being compliant? And that then will help me determine which path do we want to go down. Also, when I've seen someone, usually they've seen other providers. So I want to know, what have they done in the past that has been helpful? If somebody has failed herbal antibiotics, there may be reasons for that. For instance, they may have salicylate sensitivities, and there's a reason why they're not responding well to those herbal antibiotics, and they may actually need to go straight to using something like rifaximin. So there's a number of things I need to be able to take into consideration when determining which approach we're going to take.
So it's very individualized and personalized, because we live in the genre of functional medicine, which is root cause resolution. A lot of the people have heard me say that, and we're getting to the individual and personalized. So if I have SIBO, my wife has SIBO, and somebody else has SIBO, you're still going to treat us all differently. You're going to individualize it. So you got a great question. They'd like to know your website.
You can find me at two different places. One is at Lifespan Medicine. That is the clinic where I work. And then you can find me personally at analyticalnutrition.com.
Okay. I'm just playing around trying to get a different picture, guys, so don't sweat it. How'd you become interested in all these functional gastrointestinal disorders like SIBO? What most of the practitioners had a family member or themselves.
Yes, that happens to be the case for me as well. I mean, first it was my experience. That's what started this, and just seeing, I'll never forget my first client who had a really complicated case of SIBO. And she was one that I had actually put on an elemental diet. And this was before elemental diet, the powder was palatable. In fact, she compared drinking this solution to drinking vomit. It was that bad. But the good news was it got rid of her symptoms. She was feeling better. But the moment she transitioned off of that and had her very first meal, her belly inflated like a balloon. And it was devastating. It was devastating for her, for me, to have spent that time, that effort, and to have made that kind of sacrifice and to not get any type of long-term benefit. And that made me curious. It opened my mind. It made me think deeply about, why is this happening? And really actually getting to the root cause, because again, SIBO isn't actually the root cause. There's a motility issue. And why is the motility not working right? Why is the migrating motor complex not working right? Was there a traumatic brain injury? Does this person have a connective tissue disorder like Ehlers-Danlos? Did somebody have abdominal surgery and they have adhesions or strictures? And so I really started to go deeper into, why does somebody develop this in the first place? And how do we get to the root cause of this to address it permanently? And then the second thing was having my kids. My daughter, as a baby, developed, she had colic right away. And then we started to realize she was having pretty severe eczema, to the point where she had to wear pants for a couple of years because she would scratch her skin so much she'd break it open. And then we, kind of put the pieces of the puzzle together and realized, okay, so the dairy is what's causing this. If we keep dairy out of her diet, the eczema goes away, which was great. But then I'll never forget the day she'd either eaten an apple or applesauce, and then I watched her belly just inflate. And I'm thinking, how does a little child already have SIBO? What appeared to be anyway. And so, of course, then being invested in her health and wanting to spare her from a lifetime of suffering, it made me even more interested in, how do I permanently address this, so that she is not only, she's free of digestive symptoms, but she has a strong immune system, a healthy functioning immune system, and was able to really figure out a way to help her without even actually using testing, or in her case, using any kind of herbal antibiotic. And we were able to overcome not only the dairy sensitivity, but the eczema and the symptoms of SIBO.
When it's your child, there's nothing more personal than that. Great idea about motility. It's basically the migrating motor complex takes the food bolus, moves it from the stomach through the small intestine to the large intestine. If it doesn't make the large intestine, it's housed in the small intestine. As we said earlier, that's SIBO. That is one interesting idea. There should be 9 to 11 peristaltic contractions. Usually in SIBO, the average is about 3. You also have something called the ileocecal valve, which is sort of like a doorway between the small and the large intestine. If it's closed or if it's open, if it's closed, obviously it doesn't go from the small to the large. If it's open, you get a kickback. Interestingly enough, the movement, you also talked about food intolerances, food sensitivities. We won't discuss allergies. So in your opinion, and if you'd like to expand upon this a little, how much do you think food intolerances, which is an enzymatic issue, and food sensitivities play in the occurrence of SIBO?
It's a part of the progression of the condition, where originally a client may not have had any issues with food, not that they know of anyway. But then as those enzymes become destroyed, there is going to, number one, be intolerances. So if you're not making lactase, you're going to have lactose intolerance. And then there becomes acquired sensitivities that result as having a leaky gut. So these food particles that are now entering the bloodstream get tagged by the immune system, and we start to develop this. It's a temporary sensitivity, but it's something that still is, once you heal and seal that gut lining, is possible to overcome. In the same way that you can, once you reduce the inflammation, you can be able to reestablish those enzymes again and be able to once again break down carbohydrates. So one of the primary issues that I see is when somebody has had a lot of symptoms, and they've realized by eliminating foods that makes them feel better, they want to stay there. They do not want to reincorporate foods again because it's too risky. And there's a threat to incorporating foods that are going to cause a symptom. And so the diet becomes more and more limited over time. But that unfortunately causes more dysbiosis in the large intestine, in the colon. And we start to see shifts in the bacterial composition, and there's less production of things like short chain fatty acids. So I really try to impress upon my clients, this is temporary. Reducing the foods that cause symptoms is only to reduce your suffering, but it's not the way to actually resolve this problem. And the solution over time is having a more diverse diet, not a more restricted diet.
Right. We want the biodiversity, great point, in our gut. It's our garden of health, if you will. So the more to choose from, the better off we are. If you eat the same food every day, if you eat egg whites and oatmeal like I used to do because I thought that was the healthy meal, not to say that it isn't, it's clearly not healthy for everyone and not healthy every day. You want the biodiversity. Use the term tagging of foods. It's great because the immune system is confused. And that's why it tags it. And that was great. Now, you probably noticed I was playing with my phone. I'm getting a lot of questions. So question number one is, you mentioned diet, Nicole. What diet do you adhere to? Because they've tried the FODMAP and it's been nothing but difficult for them with the FODMAP. Yeah. So if you could elaborate on what the FODMAP is and if you found that to be effective.
Yes. So the FODMAP diet is traditionally the diet that you would use, although there are actually many other dietary approaches for SIBO. They all have the same commonality. There's like a unifying principle in that we're trying to reduce fermentable carbohydrates. What gets tricky though is that there are going to be the FODMAPs that are problematic, but then because of these acquired food sensitivities and intolerances, there may be foods that are no longer within FODMAP categories that are also problematic. And so it's just imperative that you're really working to address the root cause effectively so that you can begin to incorporate foods eventually. But sometimes the FODMAP diet itself still isn't enough. And that's even where perhaps an elemental diet can come into play. It's a sort of a similar, but in a different vein example of, I have a client who has ankylosing spondylitis. And he was one of those that just he didn't feel equipped to follow a very specific or meticulous type of diet. And so for him, I said, give me 5 days, just 5 days on this elemental diet. And if you don't have a reduction in pain and swelling, then we can set this aside. But if you do, you know that you're consuming foods that are triggering an immune and inflammatory cascade. So he did this for 5 days and the swelling and pain went down by 90%. And then he began to realize something that I'm eating is causing this. That was enough for him to get buy-in that yes, indeed, there are some food sensitivities or intolerances, but he needed some proof in advance before he was able to commit to something like this. So it takes just investigative work. And I think there are also times where there are other, biogenic amines that can be really problematic, whether that's histamine, tyramines, we have salicylates and oxalates. And so that's where I try to pay attention to, if there are certain foods that predictably cause issues, are those within a certain family? Are those histamine containing foods? Are those oxalate containing foods? And from there, I can much better, I think, direct people into a diet that's specific for them. Because again, FODMAP just might not be enough.
I love it. You spoke about the FODMAP, and I've had trouble with patients in my office. So I've looked to the elemental and or the ketogenic diet. So it's great that you mentioned that. Also, the fact that you're really reiterating the idea of we have to check for food sensitivities. And the biggest problem with the food sensitivity is you don't see the symptomology up to 72 hours. And I think we're going to get into the lion's den right now. We're going to talk about how SIBO and these functional gastrointestinal disorders can cause histamine. People don't realize histamine plays a role in brain and neurotransmitter function. digestion because your gut's in constant contact with food. It's a physical barrier. Histamine, everybody knows because they think of it as an allergic reaction. It's vastly different in the gut. So you mentioned some foods that are histamine generating. Did you want to give a list of a couple of foods that people should avoid if they're worried about histamine?
I think this is one of the biggest areas of confusion is histamine and the diet for that, because you do have foods that contain histamine and then you have foods that liberate histamine. And so if you were to go and Google a histamine diet, you're going to find 100 or more different diets. And even kind of the authorities in this area, like the Swiss Interest Group, they have different lists than some of the others. And this is because there is two kind of different categories that we're talking about. But in terms of foods that contain histamine, it's foods that have been fermented is like the biggest histamine containing group. So that's going to be like your kombucha or your sauerkraut or your kimchi. Anything that's been fermented ahead of time is going to have high levels of histamine. And then we have foods that naturally contain histamine, like tomatoes or avocados or bananas. So these foods are just naturally high in histamine. But then there are histamine liberators. They don't necessarily contain histamine, but they can liberate the production of that. That might be like pineapple or citrus. And not everybody needs to avoid histamine liberators. Again, this is very individual. Sometimes you just need to take out that, the ones that have the most, like the fermented foods and the tomatoes and the bananas and the avocado. And sometimes you need to go a step further.
Interesting, because I just got a question. They said, all right, so essentially you said fermented foods. Those are prebiotics.
That's right.
Now, we all know if we're helping leaky gut, just leaky gut, probiotic, and you want to give a prebiotic to feed it, fermentable foods. However, if we're worried about histamine, which really goes to the point overall of personalizing, individualizing, and why they need to see you and functional medicine practitioners, basically now you're saying, wait, I don't have a prebiotic because they are histamine containing foods.
This is tricky with both histamine and SIBO because in general, clients with SIBO don't tolerate fermented foods either. The sauerkraut, the yogurts, those types of foods. And it feels like a catch-22 because we really do need to have prebiotics. In fact, we're supposed to have 30 different plant species per week to make sure we're getting enough of variety with these fibers to feed all of the different species and subspecies of bacteria in the large intestine. But when you have this overgrowth of bacteria or you have a histamine intolerance, those foods aren't tolerated during that condition while you have the condition. And so we have to do workarounds to be able to prevent symptoms from prebiotics and probiotic containing foods. And so this is where I've come up with some ways to be able to get those compounds still in the individual without causing symptoms.
Interesting. So you've got processes and systems for this in your office.
That's right. That's right. So there are going to be certain prebiotics that are pretty well tolerated when somebody has SIBO or histamine intolerance. For instance, partially hydrolyzed guar gum, brand name like Sunfiber. It's generally tolerated really well. And then the benefit of using something like that is it also helps to reduce visceral hypersensitivity, which is what happens when you have both of those conditions as well. The nerves are just overly sensitized. And so there's a lot of pain and discomfort as a result of that. And so having this kind of fiber actually reduces some of that visceral sensitivity.
Yeah, these are great takeaways because I've had so many people say, you know what, I just changed my diet. I read a blog somewhere. I think I have SIBO, but, it didn't go away. It's not treatable, and they don't realize the complexity, unfortunately, to SIBO. And that's why you need the coach, the doctor, the functional medicine practitioner, because it's very, very involved. I have said that over the last 25 years, we've discussed leaky gut. And in the last 5 years, 90% of the material, if anybody wants to do a PubMed search, leaky gut, you'll find, but it's increased intestinal permeability. Right now, I believe in the next 5 years, it'll all be about SIBO and that diff-die, whether it is SIBO, leaky gut, or as you indicated, both together. Now, every question I'm asking, so everybody knows, this is, we're off the cuff. We're doing this extemporaneous. My question to you is, with leaky gut and SIBO, if I have both, which would you treat first?
Mm-hmm. You really kind of have to treat SIBO first, because otherwise there's just going to be ongoing inflammation that's going to prevent the gut lining from kind of healing on its own. The inflammation has to come down before healing can take place. So this is, again, if you try to use some of them, the nutraceuticals we've been using for years and years to heal and seal the gut lining, you're going to find that that's like trying to use the garden hose to put out the house fire. It's just not going to work. So you really have to reduce the inflammation before you try to address that. And once you get the inflammation down, the body does what it's designed to do. It knows how to heal, but it has to be in the right position to do that.
Excellent. So here's my last question. This one's a little heady for everybody, but I think it needs to be asked. Wrote it down. What do you think makes conditions like SIBO and histamine intolerance so recalcitrant? And what do you do to overcome these issues when they're together? Because obviously you're not going to get histamine intolerance just because of SIBO, but it's a conceivable possibility.
Right. So this is a sad statistic, but 2/3 of SIBO cases are refractory. So after treatment, they're going to come back. And I think in large part, this is because, one, the underlying issue has not been detected, whatever it is that's causing the migrating motor complex to not work right. So for instance, if somebody did have a traumatic brain injury, or just even sometimes they had a good bump on the head where they saw stars, this is the kind of person that may need to do like vagal retraining. And if that's not happening, you're not actually getting to the root cause of why there's a motility issue in the first place. So that's number one. But number two is, in large part, there's nervous system dysregulation. And when somebody has a condition, there's going to be kind of a more of a tendency to have sympathetic overdrive, as well as the emotional and psychological toll that this is taking. Every time there's a symptom, there tends to be a generalization that this is how it's always going to be, or kind of catastrophizing that this is going to get worse. And all of these fears and the uncertainty put people in a position that keeps them in just sympathetic overdrive. And the more cranked up the nervous system is, the more someone's stuck in fight or flight, the harder it is to resolve these issues. So we know that in order to properly digest food, you need to be in a rest and digest state. And if you're always in a fight or flight state, it's going to be really difficult to digest your meals properly. And it's also going to exacerbate or keep a vicious cycle going of the symptomology. And so we have to, as providers, we have to do a good job of helping our clients identify what is it that either helps them to destimulate or that helps them to create a new belief system around this current condition that reduces some of the fears. Because one thing I talk with my clients a lot about is kind of a context-specific therapy or a context-specific approach, where when they do have a symptom, how do you neutralize that? How do you, instead of going straight to, here we go again, I'm stuck with this symptom for life, to, this is just my body communicating something with me right now. I'm in process of getting better, and this isn't going to be the way that it's always going to be, and switching the narrative. But that has to occur. And I feel like a lot of times we spend too much time on the clinical piece and not enough time on helping someone think differently about their situation.
Yeah, I mean, I think that's a great takeaway about, them valuing health, and they have to invest some time. I have a few patients that came in yesterday and said, I got to take care of me first. I realized I was bypassing me. And I think it was a real salient point in the idea of the sympathetic nervous system going up and parasympathetic going down. That vagus nerve or vagal stimulation is critical. Again, we've talked a lot about the ability of different structures, let's say, for motility in the movement. So I got a few other questions, and they're all the same. How can they get in touch with you? I mean, I know you've got
My
Your website.
websites are the best way
Okay,
to contact me, and you can contact me directly through analyticalnutrition.com.
great. So what's next for you?
There are so many interesting things on the horizon. One of those, I mean, you're aware of this, and I think a lot of your listeners or viewers are, but just stool testing has come so far since the day
Mhm.
when we did cultures. And I'm finding this information to be unbelievably valuable. You can start to now see associations between the balance of someone's bacteria and the association between chronic degenerative diseases, anything ranging from dementia to cardiovascular disease to cardiometabolic issues. And I think that we knew that the gut was always kind of at the center of most issues, but now it's becoming so much more obvious. And there was even a situation I had very recently where I looked at someone's stool test, and before I actually knew their clinical picture, because I was just reviewing this for one of our physicians, I'm like, I'm pretty certain this individual has neuroinflammation. I'm pretty certain this person has periodontal disease. And sure enough, then when I went into the history, all those things were there. And I could tell just by looking at the balance of bacteria that this was probably the case for him. So now we don't have to guess. Before it was kind of, well, they're probably low in their lactobifidose strains, or they probably have an overgrowth of this. We can actually see this and target it precisely. So that's something that's really exciting, and I'm leveraging that information. And another thing I think that's really exciting is, so we've known about FMT for a while, fecal microbiota transplants. Now there are some new innovations that are actually allowing us sometimes to use specific strains of bacteria that would normally you wouldn't be able to repopulate through a probiotic. So for instance, if somebody has a missing species or subspecies of bacteria that's highly protective and it's gone, it's extinct. You can't bring that back. Once it's gone, it's gone. And so we have now some abilities to bring these particular species back in, like an Akkermansia. Or I even have a client who has a tendency for kidney stones, who's missing Oxalobacter formigenes. So there are some ways now that we can bring these bacteria that help to metabolize oxalates and prevent kidney stones back in. So they're called, some of them are called postbiotics or parabiotics. And I think this is going to be a game changer.
Oh, I agree. The postbiotics are, without question, the conversation piece, and the parabiotics is something that's relatively brand new, we'll say. And I think it's a great conversation. I agree with you with the stool testing. And when we're talking about the precision and the bacteria, that is the new door that everybody's going to be going through. You combine that with the symptomology in the serum, you now have a good way of personalizing and individualizing it and getting to root cause resolution. The funny thing universally with anybody who adheres to functional medicine, functional nutrition, everybody's excited because every day when you learn something new, you get the opportunity to help somebody. It's not the same old thing, and everybody's different. And I got a question. There you go.
Interestingly, I am an author, a contributing author on a book that will be coming out next year. And it is actually, I think we're going to call it the biopsychosocial approach to health, something like that. Title is still kind of to be determined, but it's a multidisciplinary book from many different providers who are essentially bringing together a unifying theme about what are these factors that promote good health, whether you're a chiropractor, a physical therapist, a nutritionist, a naturopathic doctor, and showing there's these common principles that really help to build robust health. And so my chapter is entirely on personalized nutrition. I find it really interesting that in the year of 2021, we're still trying to find the best diet. Is it keto? Is it paleo? Is it vegetarian? And there's never going to be a universal diet. It's always going to be unique to the individual. And so the chapters, how do you determine what that is for you based on your genes, your clinical labs, your family history, your symptoms, and walking someone through step by step in order to be able to do that on their own?
I agree with you wholeheartedly. There is no best diet. The best diet is the individual. The one thing I will say, and Jacqueline, who is actually a chiropractor, said, if man makes it, I won't eat it. So if we start with that, you know, we're taking out the added sugar,
Yes.
the gluten, the dairy, yada, 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 yada. Well, I got to tell you, it's been great. Everybody's really listening. We've got a great number. It's exciting. Great concert of information today. Really appreciate your time. Hope I can get you again on the podcast. Maybe we can do a little husband and wife team and be moving from musculoskeletal to functional medicine, and we'll talk about the two, and we'll have a three-way kumbaya if that's at all possible.
Oh, that'd be so fun.
It would be very interesting. Thanks so much for your time.
Yes.
You have a great day. Everybody, Nicole Visnic.
Thank you.